Hello, my name is Jessica Villanueva, and I will be talking about blood pressure. First of all, blood pressure is an important source of information that can determine where you as a patient stand with your overall health. Blood pressure was founded by a Russian physician named Dr. Nikolai Korotkov, who discovered that there are 5 distinct phases when taking blood pressure. These 5 phases are known as the Korotkov sounds. Even though there are 5 phases, the most important sounds to look out for include the first sound, which is systolic, and the 5th sound, known as diastolic. The systolic values occur when the heart muscle contracts and can be determined by a clear tapping sound. The last sound, also known as the diastolic value, is the pressure in the arteries between heartbeats when the heart muscles are resting while refilling with blood. The diastolic value is revealed when silence occurs. All values should be even numbers and measured in millimeters of mercury as their unit. Jose will now explain some factors that must be taken into consideration before taking blood pressure.
Prior to taking blood pressure measurements, patients should be seated quietly for at least 5 minutes in a chair in an upright position with both feet flat on the floor and their arms supported at heart level. Patients should also refrain from smoking cigarettes or drinking caffeine for at least 30 minutes preceding the measurements. Theoretically, the cuff should be placed on the left upper bare arm of the patient. In order to ensure accurate measurements, appropriate cuff size must be used. In order to determine proper cuff size, the bladder within the cuff should encircle at least 80% of the upper arm. Although many adults require a large adult cuff, there are also sizes for infants, children, small adults, and adult thigh. Cassie will now be explaining the proper way to use a stethoscope.
We are going to be using a stethoscope to take blood pressure. The head of the stethoscope is also known as the diaphragm and should be placed flat against the skin on the brachial artery of your left side. The diaphragm should be positioned beneath the cuff but not underneath to avoid static noise from the cuff itself. A good method for holding the head of a stethoscope is to hold the head in place with your middle and index fingers. And be sure not to hold the head of the stethoscope with your thumb due to your thumb having its own pulse, which will interfere with the reading. The earpiece of a stethoscope should be inserted inside your ear with prongs facing forward to be able to hear properly. Now Javier is going to demonstrate how to take a blood pressure reading properly.
This is the artery mark, which is placed directly over the brachial artery. The cuff should fit snug around the patient's arm. The bulb is used to inflate pressure into the cuff. The valve is turned all the way to the right to inflate, to the left to deflate. The stethoscope diaphragm is placed directly over the brachial artery, avoiding contact with the cuff or being underneath to avoid interference noise. Inflate the cuff to 200 millimeters of mercury, slowly releasing 2 to 5 millimeters of mercury at a time. The first sound you will hear is the systolic blood pressure, which is the heart contracting. The last sound you will hear is the diastolic, which is the heart relaxing, and that will be your blood pressure reading. Joshua will now explain what the blood pressure values mean.
A normal blood pressure for systolic blood pressure would be anything below 120, and for diastolic blood pressure would be anything below 80. For prehypertension, the systolic blood pressure would be between 120 and 139, and the diastolic blood pressure would be between 80 and 89. For stage 1 hypertension, the systolic blood pressure would be between 140 and 159, and the diastolic blood pressure would be between 90 and 99. For stage 2 hypertension, the systolic blood pressure would be anything above 160, and the diastolic blood pressure would be anything above 100.